everyone, so I'm Julie and this is my partner, and today we're gonna talk about a drug called mannitol. So my drug name is mannitol along with my generic name. My brand names include osmitrol, resectisol, and aridol. I am a hexane 1, 2, 3, 4, 5, 6 hexol. I am diuretic in terms of therapeutic classifications and I am osmotic diuretic in terms of pharmacologic classifications. And I am on pregnancy category C, which means there are studies that have shown an adverse effect on the fetus and there are no adequate and well-controlled studies in humans.
As a drug, I have my own mechanism of action. I increase the osmotic pressure of glomerular filtrate, inhibiting tubular reabsorption of water and electrolytes, thus promoting diuresis. My action also promotes urinary elimination of certain drugs. My effect is useful for prevention and management of acute renal failure and oliguria. My action is also useful for reduction of intracranial or intraocular pressure because I elevate plasma osmolality, enhancing the flow of water into extracellular fluid.
Next is my pharmacokinetic. So I am administered through IV and I will remain on the extracellular compartments of the body. Also, I will not cross the blood barrier. In my metabolism, I am metabolized minimally to glycogen in the liver. And in excretion, I am filtered in the glomeruli. Half-life in adults in normal renal function is about 100 minutes.
As a drug, I also have indications. Test dose for marked oliguria, suspected inadequate renal function, treatment of oliguria, prevention of oliguria or acute renal failure, treatment of edema and ascites, to reduce intraocular pressure and intracranial pressure, to promote diuresis in drug intoxication, and urologic irrigation.
Next is my contraindications. I am contraindicating patients who are very hypersensitive to the drug, those with anuria, severe pulmonary congestion, frank pulmonary edema, severe heart failure and severe dehydration, metabolic edema, progressive renal disease or dysfunction, or active intracranial bleeding, except during craniotomy. Also, I am used cautiously in pregnant women.
As a drug, I also have side and adverse effects, and this is categorized per body system. In the central nervous system, its side and adverse effects are seizures, dizziness, headache, local pain, and fever. In the cardiovascular system, its side and adverse effects are edema, thrombophlebitis, hypotension, heart failure, tachycardia, and angina-like chest pain. In the gastrointestinal system, its side and adverse effects are nausea, vomiting, diarrhea, thirst, and dry mouth. In metabolic system, its side and adverse effects are fluid and electrolyte imbalance and dehydration. In the skin, its side and adverse effects is urticaria. In the genitourinary system, its side and adverse effects is urine retention. In the senses, its side and adverse effects are rhinitis and blurred vision. The nursing responsibilities of the nurse before administering me to the patient. assess or monitor the vital signs, intake and output, central venous pressure, pulmonary artery pressure, signs and symptoms of dehydration, signs of electrolyte imbalance or deficit. For increased intracranial pressure, assess or monitor the neurological status and intracranial pressure readings. For increased intraocular pressure, elevate eye pain and decrease visual acuity.
So during your responsibilities are, you have to monitor me in the IV site and to carefully avoid extravasation and tissue necrosis. In a comatose patient, you have to insert indwelling urinary catheter as ordered to monitor urine output. Also, when I'm in, you have to monitor renal function tests, urinary output, fluid balance, central venous pressure, and electrolyte levels. You also have to watch for excessive fluid loss and signs and symptoms of hypovolemia and dehydration. Lastly, you have to assess for circulatory overload, including pulmonary edema and water intoxication, and heart failure. Lastly is your nursing responsibilities after. First is you have to teach the patient to monitor the urinary output and advise the patient to report any signs of pain at the infusion site, as well as adverse reactions such as increased shortness of breath or pain in the back, legs, or chest. I may also cause dry mouth, so as a nurse, you have to be responsible when the patient is experiencing dry mouth. You have to emphasize that fluid restrictions are necessary and frequent mouth care can ease these symptoms. Lastly, as appropriate, review all other life-threatening adverse reactions and interactions, especially those who are related to me, the drug mannitol, and tests that are mentioned before. So that's it for today. Thank you for listening to me and my partner, and we hope that you learned something about our drug today, which is mannitol. So, bye!